The majority of rotator cuff tears, including full thickness rotator cuff tears, can achieve a significant pain reduction and a significant functional improvement even without surgery. If you're someone who has just torn your rotator cuff and you're not sure what to do in terms of how to manage it, and you don't necessarily want to go down the surgical path, then this video is for you. Today I'm going to walk you through a full phasically structured rehab program that you can start working on to help you get back to sport without surgery. And before we start, I have to acknowledge that some tears are going to need surgery. These are usually the tears in younger patients, so likely you who's watching this video that have had a very highly traumatic injury, so like a high-grade contact injury, and you've got significant functional loss in that shoulder and it has not shown any signs of improving. However, if you haven't got significant functional loss and your pain is well managed, then it is likely that you will be able to rehab your rotator cuff effectively without the need for surgery. There has recently been a lot of evidence in the literature showing that people who play especially overhead sports have some kind of rotator cuff pathology. So if you're a baseballer, a cricketer, a swimmer, anything where your arms are going overhead and they're being loaded overhead, then it's likely that you've got some kind of rotator cuff pathology anyway, even independent of the current symptoms that you're suffering from. And there's also a really big body of evidence now showing that pretty much anyone over the age of even 40 is going to have some kind of rotator cuff pathology going on, and it doesn't necessarily mean you are going to have pain. So just because you have these things showing up on a scan, whether it be an MRI or an ultrasound, it doesn't necessarily mean that that is the cause of your pain or functional loss. But for the specifics of this video, we are going to talk about an acute rotator cuff tear where you have injured yourself and we're trying to avoid surgery and rehab back to sport. So without fluffing around too long, we're going to get into phase one right now, and I'm going to show you where you're going to start as soon as you have had an injury. This is phase one. So phase one, we are going to be focusing on restoring range of motion into the shoulder, and we're going to be starting to work on some static or isometric resistance-based exercises. The reason I like to start early with isometric exercise is because there's some good evidence that shows it can be therapeutic in terms of pain reduction, but it's also going to help us minimize any deconditioning that's going on at the shoulder joint because we're going to be using it less now that we have injured it. Isometrics are a great way to start loading without having to put a ton of actual movement into an already irritable joint. The first lot of exercises here we're going to do is to help achieve full range of motion again in the shoulder. So the main thing after a rotator cuff injury is if you've lost a bit of range of motion and you can't lift your arm very far, we need to start promoting a little bit of that again to stop it stiffening up too much. So the easiest way I find you can do it is get yourself a stick, whether it's a dowel rod or a PVC or the broom, whatever. You're going to use one arm, so your good arm on the stick. Your injured side is going to sit just over the end of it, and you're going to use your good arm just to slowly push your injured side up through the front, like so. And you're just going to go as high as comfortable, and you're going to work through slow repetitions of that. I don't want to see you just forcing it up there or just trying to go as fast as you can to get it moving. You also want to try and do it, as I said, through the front, but also out to the side. Again, nice and slow, just go as far as you can tolerate. Often people with this will find that they can actually get it quite high without it hurting. And if you can do that, I would fully support you being able to move it through as much range of motion as possible. So that's your flexion and abduction. We're also going to try and get a little bit of rotation as well if we can through that range of motion. And with your elbowing close to you, I'd expect you should be able to get a little bit of that at least. So that's your assisted range of motion work. You can work through that as much as you can tolerate. Again, just make sure you don't annoy your shoulder even more and make it feel worse because you're doing so much. So I'd typically recommend just doing, say, 5 reps in each direction at a time, give it a break, come back and just repeat that. So for this exercise, you're going to need either a box or a chair, something that you can just support yourself on with your uninjured side. Then with your injured side, so this is called a pendulum exercise, but with your injured side, you're just going to let it hang, let the force of gravity distract the shoulder joint down a little bit. You're going to use your body just to create a little bit of momentum, and give it a bit of a circular motion in one way. You could do that for about 20 reps or 30 seconds or a minute, whatever, and then you're going to try and get it going back the other way. Now this is a really nice exercise just from a therapeutic pain relief standpoint. If you're someone who post-rotator cuff injury is getting a lot of pain, this can help just try and calm it down a little bit and give it a bit of therapeutic movement, as well as let gravity just start pulling you into a little bit of flexion as well. The next thing we're going to be working on is an isometric hold for the rotator cuff. And we're going to do this in multiple directions. And I want you to keep the resistance comfortable. So if that means pushing at 20% effort, because that's the only amount of force you can put into it that's comfortable, then that's fine. If you can push with 100%, that's also fine, as long as you can tolerate what you're doing. Like I said in my previous videos, we want 4 out of 10 pain or less, even maybe 3 out of 10 pain or less. We don't want to be forcing it into higher levels of pain. So for this, elbow is going to start in close to us. I'm just going to be pushing against my rack here, but if you've got a wall or a doorway, whatever, you're going to push the back of your wrist into it, keeping your elbow tucked into you, chest up nice and high. I'm going to push the back of my wrist. So I'm trying to get this action going, pushing the back of my wrist into the rack, and I'm going to hold for 10 seconds, and then I'm going to rest for 10 seconds, and I'm going to repeat that 10 times. So nice and easy rule of 10s. So I'm going to push that way. I'll come to the other side and I'm going to pull inwards, and then I'm also going to get my fist on it, give it a bit of a push in that direction, and then you can also turn yourself around, get your elbow against it, and give it a push backwards. Now, if getting your shoulder into a bit of an extended position is uncomfortable, just wrap a towel or get a yoga block or a foam roller just to chock it there, keep your elbow in against you, and then just push back from there. So they're your isometric exercises that you're going to start with. Welcome to phase 2. This is when we're going to start loading the shoulder joint through some actual movement, and we're going to progress to a little bit of push and pull exercise with our elbows close to our body. You can progress to this phase once movement is relatively pain-free through range of motion. So from our phase 1 isometrics to now our phase 2 isotonic exercises, where we're going to be moving through a bit more range of motion. This is going to be like your typical banded external rotation that you've probably seen in every single like physio blog or video ever. These are a really nice way to start. You want some light resistance that you can just work through range of motion. If you really struggle to get out there into external rotation, you can simply start with that arm in internal rotation and just pulling to neutral and just working through that, and then you can build range of motion as you get a little bit stronger and more confident in what you're doing. It wouldn't hurt to pull in through internal rotation as well, depending on the site of the rotator cuff injury and what you can and can't tolerate. I'm also a fan of like laying on the bench or the floor and doing side-lying external rotations. That way, anything that you can start working through range of motion with a little bit of load is a great way to progress from the isometrics. The next thing we want to do is also make sure we've started progressing into pushing and pulling exercises. So again, with the resistance band, we can start off with a simple band resisted row where we're keeping our chest up, we're getting a little bit of shoulder retraction and just pulling in with that band towards our stomach and trying to keep that forearm relatively neutral. I don't want to see it being pulled up here. And we're just trying to feel a bit of activation through our upper back and our lat muscles. So we've got the pulling exercise there, and then the simple pushing exercises will bring it up a little bit higher, trying to get the band tension onto it. Again, if you really struggle to get into that extended position, you can start with your upper arm in a neutral position next to your body and just pushing forwards. And we're just trying to get some pushing activity working with our elbow in close to us. Now, if that feels all right, you could pretty quickly progress this into something like a dumbbell press and row, where your chest supported on a bench or laying on your back, and you're doing your push-pull with dumbbells, elbows in close. Again, as long as it feels tolerable and you can do that and you can load it a little bit, then I'd be okay with you progressing to that as well. The other thing I should mention too is that the main reason we want to keep our elbows in close to us when we start the pressing and pulling exercises is that it's a lot less loading on the rotator cuff. So if you come out here and you're starting to push and pull out here, it's going to be a lot more loading on the rotator cuff, potentially something it's not ready for, and it's likely going to hurt a lot more to do it that way as well. So keep it a lot less threatening to the shoulder and just start through here. And as it recovers and you build your tolerance back up, we're going to start progressing the elbows out away from us. This is phase 3 now. So here we're going to start loading the shoulder away from the body a little bit more. So as we bring our arm out, like I've explained, it's going to load that rotator cuff harder. So we're going to, if we can, and it's pain-free or minimally painful, we're going to start loading it away from our body. And if you're able, we're also going to start progressing loading to an overhead position as well. Now we're going to start progressing the loading of our shoulder away from our body, okay? So before, as I mentioned, we're pushing and pulling through here. We want to now start loading ourselves away from our center. So typically I like to start with a plate. I don't like using a band to start because as you pull a band, it's going to get harder and harder and harder in the more compromised positions as you get further away from yourself. So like I said, I typically won't start there. I also typically won't start 100% into an abducted position or through that sort of frontal plane. I'm coming more on like a 30-ish degree angle through what they call the scapular plane. So we're going to start not in front, but slightly away from us, okay? So we're just going to go thumb to the ceiling, and we're just slowly raising up with that weight as high as we can comfortably go, and then we're going to control it back down as well. So that's the initial start of this phase, to work through, again, slow repetitions in that scapular plane. Then we can start progressing that more into that abducted position. Again, if it's comfortable, you can start with your thumb up, or you can start raising in that typical like lateral raise where we're hitting the side delt movement. Doesn't really matter as long as the movement is comfortable and you can load it effectively. The next thing we're going to be doing here is loading overhead, as long as you can tolerate it, again, just like all the other things we're working on here. So you're going to get yourself a dumbbell. You're going to go elbow underneath your wrist in a relatively neutral position. I don't want to see you starting to load it out here. Just like all of our other push-pull movements, we're still working through elbows in and trying to get stronger in that position before we start loading the rotator cuff out away from us. So elbow in, and we're just pushing straight up nice and slow and controlled, trying to finish over our head and then controlling it back down. Now, if you really struggle with this, I do like to start in a seated position, but you can slightly lean back onto a supported surface just to make it a little bit easier to start. So if you've got a bench that adjusts, again, we're here and just slowly pushing up overhead and controlling it back down. So we can start off with something pretty light, making sure that it feels good to do the movement. And we're going to work through about 2 to 3 sets of that. Relatively high reps. I typically will push up towards even 20 per set, just to try and build a little bit of tissue capacity back, because all of that is going to have been lost, and it's going to limit how much we can load it as well. So if you're doing sets of 20, you're not going to be able to load yourself so heavy that you overblow it too early. In phase 4 of rehab now, we're going to start progressing our pressing and pulling exercises with elbows further away from our body. Again, granted that we can tolerate that. And overall, we want to see load progressing on our big pushing and pulling exercises and that of what we can put on our rotator cuff. So phase 4 here, we're starting to progress our loading on the shoulder, and we're also going to be progressing how far away our elbows are now coming from our body. So to demonstrate with a simple 30-degree incline press. So again, typically if you want to do flat 30, 45 degrees, it doesn't matter too much. Just the higher you go up, the more of an overhead press it becomes, whereas obviously flatter, it's just more of that typical horizontal press, and the 45 degrees will be somewhere in between. So we're going to lay here. So typically what we were working on is elbows in close. We're going to start bringing them out a little bit. So again, 30 to 45 degrees. I don't want you to rip them straight into 90 degrees and start pressing through there. We're going to come somewhere in between, working on just pushing through that range of motion. If you find it a bit of a struggle to start, you can just cut your range a little bit so you don't get so deep into full range of motion. So if you can only get about halfway and you're just going to work through repetitions of that, then that's fine. But if you can get yourself into a full range of motion, feel a bit of stretch through your shoulders and your pec, and then slowly work in and out of repetitions of that, then that is also fine as well. So we're going to do that for the pressing movements, for the rowing or pulling movements. And here, instead of seeing our elbow being really in tight and trying to pull that shoulder back, we're going to be a little bit more out again in that 20 to 45 degree position with our elbow, and just progressing the position of that elbow relative to the body away from us. So if you do find it a little bit awkward to row with a dumbbell out there away from you, you could just progress to a bar where you're in that fixed hand position and you're pulling a little bit more in like that with both arms. The only thing to remember there is that maybe your uninjured side will take over a little bit, but again, you can load it a little bit more on the barbell, so it's not going to matter that much in the grand scheme of things. In this phase, we are also going to be working on a little bit more scapular control work, so the control of our shoulder blades, because having good control of our shoulder blades is going to also underpin rotator cuff function. Now, for this one in particular, I really like it. It's called a wall slide, and it's going to work really hard on control through that serratus anterior in particular, but I wouldn't recommend doing it on a brick wall. I just don't have another one available to show you right now. But what you're going to do is grab the outside or inside of your palm and a little bit of forearm on the wall as well. On the brick wall, I'm going to slightly come off it so I don't grate my forearms, but what we're looking for is the shoulder blade. As we raise up along that wall, we're trying to think that we're really reaching up with that shoulder blade, and we also want to picture it rounding around our rib cage as we go and getting a little bit of rotation upwards as we go up as well. So I'm working on that start position, feeling like I'm getting my shoulder blades to really rotate up and around my rib cage. Hold, and then I'm going to control it back down as well. So these ones are really important to do nice and slow and controlled. You could do like 5 reps at a time. If you feel like you're starting to lose it or you can't really feel it, then slow it down, pause the movement, try and feel the position and really picture those shoulder blades moving around and up that rib cage as you move up with your arms. This is phase 5 now, and in this phase we are going to start loading more in that sport-specific nature. So if you're someone who has to mark a footy overhead or you have to throw a ball in your sport, you're going to start reintroducing those skills. And to the gym rehab side of things, we're also going to start introducing more like perturbation or higher velocity type work to really challenge the cuff to stabilize a higher speed type of load. For this exercise, you're going to need a kettlebell. Now, I'm a big fan of this because it's going to really load the rotator cuff hard in that abducted position away from your body, but we're also going to introduce a bit of rotation to it as well. So you're going to grab your kettlebell, lay yourself back. Kettlebell starts in that sort of Turkish get-up position if you've ever seen one or done one of them. Arm is coming out to the side. Then we're going to roll ourselves over. We want to get this shoulder on top of our other shoulder. We want to keep ourselves nice and upright, eyes on the kettlebell. If this bothers your neck, you can get a foam roller under your head just for comfort. Now what I'm going to start doing, holding this, I want to rotate in as far as I can and then back out as far as I can. And I'm looking to just control that kettlebell through range of motion. I want to see and feel like I have to fight to keep that kettlebell in position. If I don't have to fight it, the kettlebell is too light and you need to go a bit heavier. Alternatively, if you can't keep it up there and you're dropping it, it's too heavy, so you need to go a bit lighter there. So we're looking for 5 reps each direction, and then we're going to control it back down as well. So that's your kettlebell side lying screwdriver. This exercise, this is that shoulder perturbation type of movement that we're trying to look for. Now, this is going to cause that rotator cuff to have to really quickly dynamically stabilize the shoulder as we're bringing in like a little bit more of an unknown movement. So what I mean by that is we're going to try and get into like a a similar like throwing stance if you're in a throwing sport, or just you can even try and mimic positions of the sport that you do play. So if you're a swimmer, you might want to be sort of up higher here. For a thrower, you might want to be more out here. Again, it just depends the positions you're on. I've got my band attached to something quite high, so I'm up on a band peg up there. I'm going to get myself here. Now what I want to do is I want to do a little bit of repetition here, but I also want, if I have access to someone, to come along and just give that band a good whack as I'm trying to do those reps. And you can see straight away as I hit that, my shoulder's having to try and stabilize as I move through that range of motion. You can do it in that direction. We're also going to come back and do it in the opposite direction as well, just to try and challenge our shoulder through different planes of motion, different angles, different directions. So we have to work hard on stabilizing multiple different movements and positions. If I have someone to assist me, you could say, all right, shut your eyes. They're going to give it a hit when you don't know it's coming, and that's going to challenge that from a little bit of a more neurological angle to have to quickly stabilize an unexpected force. The other exercise that I like to use to add speed to those end range shoulder positions are snatch variations. So if you're trained in a barbell snatch, you could use that. Otherwise, something that's a little bit easier to learn is a kettlebell or a dumbbell snatch. So as an example, you can either start from the floor or you can start from the hip, but we want to be really explosive with the hips and putting it overhead. And having to catch in that position is again adding speed and load to those end ranges of motion of the shoulder. Now the other thing you want to be doing is hitting your big heavy strength movements with full amounts of loading that you would normally do, but we also want to add speed into the mix as well, like we've spoken about. So you should be able to hit your pull-ups and hit them really well through full range of motion. And you should also be able to hit up your bench press relatively heavy as well as for speed. So we want to see it moving fast. The benchmarks you need to hit to finally be able to get out of this rehab and back to full participation in sport is that we want strength to be within 5% of our injured to uninjured limb, okay? So if you're really lacking in an area, you need to bring that up before you can exit rehab. Then the second thing that you need to hit is full pain-free range of motion in all aspects of your shoulder movement. And finally, you need to be able to perform your sport-specific skills without any sort of hindrance from that previous rotator cuff injury. If you can tick all of those boxes, you've done your rehab, you can move on and get back to it. So I hope this video has helped you get a better understanding of how you can rehab your rotator cuff injury without the need for surgery. Now remember, it's likely that this process is going to take months to achieve a full outcome rather than over a course of weeks. But remember, if it is going to save you going under the knife, the outcome is definitely going to be worth the effort. Now, if you are someone who does tend to suffer recurring shoulder injuries, then I have a video here that's going to fully explain to you why that is and what you can do about it to stop it continuing to be an issue.